Hi everyone, I'm Dr. Geyer. Welcome to my YouTube channel.
And I'm Marion, the health coach.
And we are continuing on our SIBO exploration in our series here.
Yeah, and so today we're going to be talking about the importance of phase 1 and phase 2. Dr. Geyer has been an expert in SIBO for the last 6 years and is a very, very good at treating SIBO and getting rid of it completely. But there are 2 parts to the protocol, and phase 2 is often overlooked, so I'm pretty excited to dive into that part of it. But in our first video, we talked about what SIBO is, the symptoms leading up to it, and strongly suggest that you get tested. So now, if you test positive, this is where you can expect.
So there are a lot of camps out there. I want to start there. Physicians that are treating SIBO that have different viewpoints on how it should be treated. And this is based off of my research and my clinical experience, which has drastically changed over the years as science has, emerged, and I've had more and more of the non-textbook. Really, no one with SIBO is totally textbook, but there are some very, very definite patterns. So a key piece of my treatment approach is these 2 phases that Marion was talking about. The first phase is all about eliminating the small intestine bacterial overgrowth. If we don't get rid of the SIBO completely, it can grow back and grow back and grow back. And this is a big part of how people end up with SIBO for, their whole lives, is what I hear quite a bit. So this chronic SIBO. So we address the SIBO itself depending on what tests tell us what type of small intestine bacterial overgrowth and their numbers, which make a big difference. I said in one of my previous videos where we were talking about this, that the numbers could be 22 combined or they could be 147 combined. And those are very different. We're looking at different things there, methane versus hydrogen, and the treatments that we would look at, are they pharmaceutical? Those are going to vary. Are they herbal? Those will vary a little bit as well. And then there's the elemental diet. So this is all phase 1. Those are the 3 main ways that we treat, is pharmaceutically, with herbs or botanically, or with elemental. Now some people are doing SCD or FODMAP to treat. This is not a treatment. This does not eliminate. It will manage symptoms. And so this is super, super, super important. Once phase 1 is done, and we have retested and make sure that it is completely gone so that no one ever has to deal with this ever again in their lives, we move into a phase 2. And so this is where I approached Mary and said, please help me with this. I don't know how to guide patients in the diet portion. I know the supplement portion and healing up someone's gut.
Yeah, and please ignore the ringing. We don't know how to turn it off, so bear with us.
All right, technical challenges every time.
And we're just going for it, so just be patient with us. And if you are super tech savvy and have some tips, we would love to hear about it. All right, so phase 1, again, is eliminating the SIBO so that it does not return. But you can't just stop there. This is where conventional treatments falter. Because the damage that has been done has to be healed so that you can start getting your life back and feeling good. If you don't heal your gut, you're not going to feel good. It's going to lead to other symptoms. It's kind of like a domino effect, right? So Dr. Geyer, through all of her research and clinical experience, developed a 6-phase dietary protocol that starts the healing process and helps to ensure that the SIBO doesn't return, and then a reintroduction phase. So it's really 2 parts. So we have the heal and restore, and then we start to rebuild from there. So phase 1 is 3 parts. We go into a diet that really, for about 3 weeks, that's really focused on healing the gut and giving it a break. We're very nutrient rich and very low in fiber. And then we transition into a repair diet. And we're gonna be on that from anywhere from 3 to 6 months, depending on symptoms. And then from there, we start reintroducing in a very strategic way so that you don't experience severe gas, bloating, and pain that happens when you reintroduce foods. And we do that very slowly in a very guided way, pretty individualized, but there is an endpoint. So you're not living this lifestyle forever that people on forums and on Facebook and things are saying you have to do it forever, and you're on this low fiber, super confusing diet. Like, yes, you can have 3 spears of asparagus and a quarter of an avocado, but you can't have more than that. And you're like, well, what the heck do I even eat right now? Like, what happens if I eat a half?
This is legal and this is illegal for the rest of your life.
For the rest of your life. No, now people do live that way when it's not treated.
Yes.
But it's not supposed to be that way. It is a therapeutic diet that is fantastic, but you're supposed to be able to transition back into normal, healthy eating. And so that is our approach to resolving SIBO and healing the gut so that you can experience vibrant health and see the doctor once a year for your labs.
So in summary, there are 2 main phases of the treatment itself. 1, we eliminate the bacteria because it needs to go away. Nobody wants a cow farm in their gut which is producing methane. That's what the cow farm smells like. That's what it is. And then 2 is to heal up and restore the gut, which is the intestinal lining. It's the components of the intestinal cells, it's the nerves, and that's done through diet and very specific supplementation in that phase 2. So with the phase 1 and the phase 2, people will heal. They will be cured of SIBO and they will get their lives back and move on.
Which is the best thing ever, because wouldn't it be nice to just live our life and be able to eat? All right, so we have a ton more videos coming up. We are very excited. We would love to hear from you and what your experience has been with getting treatment and what support that you feel was lacking. And if you just recently tested positive and you are really wanting some guidance, you can get the phase 2 program, and you can start it now. And go into it. And if you feel like, oh, I just did my medication, never got tested again, you should probably get tested. And we have a $10 off gift for you for watching this video, because testing needs to happen. We need to know if it's gone. Because maybe you were at that 147 and now you're at 69 and there's still a lot more room to go. So make sure that you're not guessing, that you're getting tested, and you work with a practitioner who knows what they're doing, that they're not just a general GI specialist, but they know SIBO inside and out, so that you can get the best care possible. That is what you deserve, and that is what we want for you. So stay tuned. We got a lot more videos coming your way. We're really excited about it. And if you have any questions, please reach out. The contact link is below also, and we would love to hear from you.
We'll see you next time.
Bye.